Hi, hello RN. So I hope you are better. You are preparing for your upcoming NCLEX RN exam. So I'm going to share some information about 90 days NCLEX RN content strict plan with you, because sometimes we don't know the right path, right way to reach the our target. So I'm just telling you the 90 day script plan, how you will prepare your exam and how you will read day by day to increase your approach. So first day you just read about introduction to NCLEX RN and exam pattern. First day you just read about the introduction and the exam pattern, because this is very important. This is the very basic thing you should know about this. Day 2 you will read about patient safety and infection control practice questions. Patient safety is very important. This is very initial thing we should know about it. So first day 2 you will read about patient safety and infection control practice questions. Day 3 airway breathing circulation priority questions. Day 3 you will read about airway breathing circulation priority questions. Day 4 you will read about miss low priority and NCLEX questions. Day 5 you will read delegation and assignment questions. Day 6 try to read therapeutic communication questions. And day 7 fundamental nursing practice questions. Day 8 vital sign assessment questions. Day 9 try to read fluid and electrolyte questions. Day 10 acid base balance questions. Day 11 intravenous therapy questions. So these are the important topic you should know about. You should read every day. If you are not completing your last chapter, so you can make a plan, you can make your timetable according to your way. So day 9 we have discussed fluid and electrolyte. Day 10 acid base balance questions. Day 11 intravenous therapy questions. Day 12 blood transfusion questions. Day 13 shock and NCLEX questions. Day 14 sepsis and NCLEX questions. Day 15 hypertension questions. Day 16 heart failure questions. Day 17 myocardial infarction questions. Day 18 cardiac dysarrhythmia questions. Day 19 ECG interpretation basics. And day 20 respiratory disorder questions. Say day 21 asthma and NCLEX questions. Day 22 COPD and NCLEX questions. Day 23 pneumonia and NCLEX questions. Day 4 tuberculosis and NCLEX questions. Day 25 is diabetes mellitus questions. Day 26 insulin and NCLEX questions. Day 17 thyroid disorder questions. Day 28 adrenal disorder questions. Day 29 renal failure questions. Day 30 is dialysis questions. Day 31 urinary tract infection questions. Day 32 liver disorder questions. Day 33 hepatitis questions. Day 35 cirrhosis questions. And that was day 34. And day 35 gastrointestinal disorder question, GI disorder questions. Day 36 peptic ulcer questions. Day 37 pancreatic questions. Day 38 bowel obstructions questions. Day 39 neurological assessment questions. Day 40 stroke and NCLEX questions. Day 41, seizure related question, epilepsy related questions. Day 42, increase intracranial pressure questions. And day 43, Parkinson disease questions. Day 44, multiple sclerosis questions. Day 45, musculoskeletal disorder questions. So I told you I have prepared 90-day script plan. So this is half script we have discussed. Day 45 till day 45 you just start your preparation. If you are not able to prepare the whole questions in a day, you can choose according to your way, your choice. You can search, you can take 2 to 3 days for a topic, day 4 days till week for a one topic, close it, then start according to your choice. I told you just some way to start your preparation, because sometimes we don't know how to prepare, how from where we start. So this is the simple way I just give you. Just choose it if your way and prepare your NCLEX exams. I hope you are better. Best of luck. Thank you. And please subscribe the channel and like the video for more these kind of informative videos. Thank you.